Black Dahlia. Episode 4. Autopsy. January 16, 1947. Chief Autopsy Surgeon, Doctor Frederick D. Newbarr and Assistant, Dr. Victor Cefalu, conducted an autopsy. The official and complete report of said autopsy has never been released to the public. Strange for a case this old, wouldn't you say? However, details have been pieced together over the years through press reports, leaked handwritten accounts, and the incomplete testimony taken during the coroner's inquest hearing conducted on January 22, 1947. Possibly the most complete testimony of the autopsy was written in the 1995 book, Daddy Was the Black Dahlia Killer, by Janice Knowlton and Michael Newton. Although this book has been thoroughly debunked, it is important to study even some of the most dubious content to find one sliver of truth that might point to a larger truth or at least fill in the blanks. Janice Knowlton was a troubled woman who had undergone medical treatment for which she received the wrong treatments and/or medications. Her medical problems exacerbated other issues she was suffering from, which included the surfacing of false memories. Her accounts of Beth Short do not match what is known about her. And Knowlton's family also took issue with the events portrayed in the book. Sadly, Knowlton never got the help she needed and died by overdose of prescription drugs on March 5, 2004. The Orange County Coroner's Office ruled the death a suicide. Knowlton's family believes her death was caused by an accidental overdose. As stated in the book on page 350. Our copy of the autopsy protocol on Elizabeth Short was furnished by a former detective with the Los Angeles County Sheriff's Department who copied the document by hand and then typed it. I will leave it at that, and allow you the viewer to determine its value.
Office of the County Coroner. I performed an autopsy on Elizabeth Short on January 16, 1947, at the Los Angeles County Coroner's mortuary and found the immediate cause of death, hemorrhage and shock due to concussion of the brain and lacerations of the face. Examination. The body is that of a female about 15 to 20 years of age, measuring 5 feet 5 inches in height, and weighing 115 pounds. There are multiple lacerations to the mid-forehead, in the right forehead, and at the top of the head in the midline. There are multiple tiny abrasions, linear in shape, on the right face and forehead. There are 2 small lacerations 1/4 inch each in length, on each side of the nose near the bridge. There is a deep laceration on the face 3 inches long, which extends laterally from the right corner of the mouth. The surrounding tissues are ecchymotic and bluish-purple in color. There is a deep laceration 2.5 inches long extending laterally from the left corner of the mouth. The surrounding tissues are bluish-purple in color. There are 5 linear lacerations in the right upper lip, which extend into the soft tissues for a distance of 1/8 inch. The teeth are in a state of advanced decay. The 2 upper central incisors are loose, and 1 lower incisor is loose. The rest of the teeth show cavities. Upon reflecting the scalp, there is ecchymosis in the right and upper frontal area. There are localized areas of subarachnoid hemorrhage on the right side and small hemorrhagic areas in the corpus callosum. No fracture of the skull is visible. There is a depressed ridge on both sides, and in the anterior portion of the neck, which is light brown in color. There is an abrasion, irregular in outline, in the skin of the neck in the anterior midline. There are 2 linear abrasions in the left anterior neck. There are 2 depressed ridges in the posterior neck, pale brown in color. The lower ridge has an abrasion in the skin at each extremity. The pharynx and larynx are intact. There is no evidence of trauma to the hyoid bone, thyroid or cricoid cartilages, or tracheal rings. There is a small area of ecchymosis in the soft tissues of the right neck at the level of the upper tracheal rings. There is no obstruction in the laryngotracheal passage. There is an irregular laceration with superficial tissue loss in the skin of the right breast. The tissue loss is more or less square in outline and measures 3¼ inches transversely and 2.5 inches longitudinally. Extending toward the midline from this irregular laceration are several superficial lacerations of the skin. There is an elliptical opening in the skin located 3/4 of an inch to the left of the left nipple. The opening measures 2 3/4 inches in a transverse direction and 1 1/4 inch in a longitudinal direction in its mid-portion. The margins of these wounds show no appreciable discoloration. There are multiple superficial scratches in the skin of the left chest on the anterior wall. There is a healed scar in the skin of the right lower posterior chest at the level of the 9th rib, which measures 3 1/4 inches in length, and its direction is diagonally to the right. Crossing this scar are 3 scars, which appear to be healed suture scars. There are 4 small superficial lacerations in the skin of the lower chest on the left side close to the midline. There is no discoloration at the margins. There are superficial linear lacerations in the skin of the upper left arm on its external aspect. There is a double ridge around the left wrist close to the hand. The fingernails are very short, the thumbnail measuring 5/16 of an inch in length, and the fingernails measuring 3/16 of an inch in length. There are superficial lacerations and scratches in the skin of the external surface of the right forearm. There is a double ridge depressed around the right wrist. The fingernails are very short, the thumbnail measuring 3/16 of an inch in length, and the others 1/8 of an inch in length. The palmar surfaces of both hands are somewhat roughened, but no firm calluses are seen. The organs of the chest are in normal position. The left lung is pink in color and well aerated. The right lung is somewhat adherent due to fairly firm pleural adhesions. The lung is pink in color and well aerated. There is a calcified thickening of the 9th rib on the right side in the midscapular line. The heart shows no gross pathology. The trunk is completely severed by an incision, which is almost straight through the abdomen, severing the intestine at the duodenum and through the soft tissue of the abdomen, passing through the intervertebral disc between the 2nd and 3rd lumbar vertebrae. There is very little ecchymosis along the tract of the incision. There is a gaping laceration 4 1/4 inches long, which extends longitudinally from the umbilicus to the suprapubic region. On both sides of this laceration, there are multiple superficial lacerations. There are multiple crisscross lacerations in the suprapubic area, which extend through the skin and soft tissues. No ecchymosis is seen. There is a square pattern of superficial lacerations in the skin of the right hip. The organs of the abdomen are entirely exposed. There are lacerations of the intestine and both kidneys. The uterus is small and no pregnancy is apparent. The tubes, ovaries, and cul-de-sac are intact. The labia majora are intact. There is an abrasion which extends through the lower half of the labia minora, and the margin shows some bluish discoloration. Within the vagina and higher up, there is lying a loose piece of skin with fat and subcutaneous tissue attached. On this piece of loose skin there are several crisscrossing lacerations. Smears for spermatozoa have been taken. The anal opening is markedly dilated, and the opening measures 1 1/4 inch in diameter. The mucous membrane is brown throughout the circumference of the opening. There are multiple abrasions, and a small amount of ecchymosis is seen at the margin. The laceration of the mucous membrane extends upward for a distance on 1/2 inch. At a point about 1 inch up from the anal opening there is a tuft of brown curly hair lying loose in the anal canal. The hair corresponds in appearance to the pubic hair. Smear for spermatozoa has been taken. There is an irregular opening in the skin on the anterior surface of the left thigh with tissue loss. The opening measures 3 1/2 inches transversely at the base and 4 inches from the base longitudinally to the upper back. The laceration extends into the subcutaneous soft tissue and muscle. No ecchymosis is seen. There is a ridge in the skin of the lower right thigh, anterior surface, located 5 inches above the knee. There is a diagonal ridge in the skin of the upper third of the right leg, which is light brown in color. Extending down from this point, there are 3 light brown depressed ridges. There is a circular ridge around the left lower leg, and also a diagonal depression ridge just below this area. The skin of the plantar surface of the feet is stained brown. The stomach is filled with greenish-brown granular matter, mostly feces, and other particles, which could not be identified. All smears for spermatozoa were negative. Frederick D. Newbarr, M.D. Chief Autopsy Surgeon in association with Victor Cefalu, M.D., Assistant Chief Autopsy Surgeon.